Good evening. I'm Dr. Allan Perel, and this is Conversations in Medicine. We have two wonderful guests here today, and we're going to talk about a very complicated topic. We're going to talk about vaccines. We know about vaccines. We've taken vaccines our whole life. There's been a lot of communication, ideas, miscommunication, thoughts that may be right, may be wrong, and how do we sort all of this out? So this is really a very interesting topic, and I have two wonderful guests who I've already spoken to, and I've learned a lot about even in the past 20 minutes that we've been talking. So first I want to introduce Dr. Jessie Saverimuttu, who's the head of who's an infectious disease specialist at Richmond University Medical Center, who I work with all the time and work with the residents.
Yes.
And I have Dr. Gauvain, and you're a internal medicine resident at Richmond University Medical Center, and it's an honor and privilege to have you guys here.
Thank
So
you.
usually we have a longer introduction. I'm going to jump right in.
Yes.
First of all, for everyone, what's a vaccine?
Okay, vaccine is an agent that helps the body to fight infections. That's the simple definition of that.
And they're different. And why can't you have one vaccine do everything? Why is there different vaccines?
So to put that into perspective, we have to understand infectious diseases. So what are infectious diseases? They are diseases that are caused by pathogens, microorganisms. So you can classify them as viruses, bacteria, fungus, parasites. These are the major classes.
Germs, what we used to say when I was
Yeah,
growing up.
germs.
Right.
But there are the big worms, which are not really germs,
Right.
but they go under parasites. And the fungus, you get the yeast and the mold. We're not talking about those. The infections that have to be combated by vaccines are the viruses and the bacteria. So for these classes, there are different categories of vaccines. For the viruses, usually you would say, take the virus itself and make it attenuated or modified, so you can have a live particle, but you modify it so that it does not cause the disease itself, but it causes a disease subtly, but at the same time helping the body to produce the antibodies that it needs. That's the live one. The inactivated...
Give us an example of a live one.
Yeah, the mumps, measles, rubella, the chicken pox, these vaccines are live.
Right.
So that's why one has to be careful. If someone is immunocompromised, you really cannot, you have to be extremely cautious.
Because
and
they can get some...
Then they can get the real disease itself.
Mm-hmm.
These are the live vaccines, just the common examples of the live vaccines. The inactivated vaccines, you take the pathogen itself and then you inactivate it and then give it to the human being. They produce antibodies through that. But the live vaccines have a longer lasting, because they're really virulent, like live, and the body attacks it, and the antibodies are long lasting. The inactivated vaccines are also long lasting, but not as much. So you have to give boosters for those.
So give us a few examples. The flu shot with influenza.
Yes, flu shot is a kind of a different category. Like inactivated would be the polio vaccine. So that is inactivated. You take it and then it produces immunity, and then you have to keep giving the booster doses. Not a lot of them, but somewhat a few of them. So that is the inactivated vaccine. Then there are the kind of the subunit vaccine, which means that you take a portion of the pathogen, a virus or a bacteria, a portion of it, and you give that, and then the body produces immunity against that. So that portion has to be carried in a vector. So there are different vectors which carry it. And the other category, which we don't have many of, but many people would have heard of this though, where you use the toxin. You get a toxoid, and tetanus is the common one. So that's tetanus toxoid that we give. So these are the different classes, but then now we have the new one, which for COVID has been the one that has been used, which is the mRNA vaccine. So that's a different mechanism of action. So in the mRNA vaccine, what is done is the mRNA, which is actually the nucleic acid, which codes for the protein. So at the beginning, I should have told, the vaccines are of the proteins that make up the bacteria or the virus and the body produces antibodies against these proteins, which are called antigens. So in mRNA technology, what happens is the mRNA codes for the spike protein of COVID, so the protein. So the mRNA is injected, and then that gets transcribed into the protein.
So the body makes that protein and it attacks
and that produces.
And by definition, there's no virus there, so
No
you can't
virus
get the
there.
virus with
You
it.
cannot get the virus, but it's a particle that actually evokes the immune system to produce antibodies against
And what I think
it.
is so interesting about vaccines in a lot of ways, and we're going to talk about it from an infectious point of view, is vaccines are being looked at now against cancer.
Yes.
And using the term very largely, and also autoimmune disorders.
Yes.
As someone who does a lot of work with neuroimmunology and MS, there are ways that we're trying to find a way to dampen the immune system from doing things that we don't want it to.
Yes.
So we call this the adaptive immune system, which is the part of the immune system that we could change
Yes.
in order to prevent infections, reduce the risk of cancer, people with autoimmune diseases like lupus or MS, be able to treat them for it.
Yes.
So now let's go back to the clinic. You go to the clinic every week. You see patients in the hospital every week. And I'm sure there's a family member every day who says to you, is COVID still around?
Yeah.
And do we have to take a vaccine for it?
Yeah.
What do we say?
I mean, listen, it's a common question we have from patients we see in the clinic. It's a real concern. And I think, COVID at its peak in 2020, 2021, it was quite an epidemic at that time. But I think still now we still have cases up till now. So we say we're in an endemic phase right now with COVID. So I tell them, yes, you still have to, especially with winter coming, right? We're going to have cases. We're seeing a lot of cases right now in the hospital. So they have to take it, especially people who are immunocompromised, elderlies. I think it's a vaccine still, they still have to take it.
So I'll say to you the first question.
Yeah.
Other people at our hospital, at Richmond University, and all the hospitals, probably any large hospital, that have COVID.
Yeah.
Are there people there right now?
Yes, we do have patients.
Yeah, we do get one or two cases coming in, and the past week we did see kind of a jump, and that's what we're anticipating, I suppose, as the weather changes.
But yes, every day I see someone, I walk by a room where it says COVID precautions, and we see this every day. So there are people, and for our people out there, our audience, COVID is still there. This is not gone. People get COVID, and now we're going to talk a little bit about the vaccine. We do have people who are immunocompromised, and Dr. Jessie, maybe help us a little bit about what the recommendations are, because there have been some mixed signals that have come out of the scientific community,
Right.
governmental agencies.
Yes.
And what I think what you and I and Gavin basically treat patients is the way we would treat a family member.
Yes.
And yourself. Would you take the COVID vaccine? Would you recommend to this patient that you would take it? And obviously the patients have different things at different ages. They have, whether their immune system is fully competent or fully fine or not. So tell us, what recommendations do you have when people walk in to the hospital, or the residents ask you a question as the authority and say, Dr. Jessie, should this person get the COVID vaccine?
Right. So now at this time point that we are in regards to COVID, as compared to 2022, 2023, we did not know which direction COVID would go. And in reality, the pandemic opened our eyes. People just died. So this we can correlate to why vaccines were really produced. If we understand why vaccines were produced, then we know that the motive of producing the vaccine was totally pure, to prevent deaths. So go back to the 1700s. Smallpox was killing people, and there was no help for the people. So it is then that they started looking into vaccines and the cowpox, and injecting. Cowpox was much less lethal than smallpox, so injecting the cowpox substances into people, and that produced immunity. So that was the start of vaccines. So correlating that to what's going on now, at the height of the pandemic, we wish there was something that would prevent deaths. And when this vaccine came, we were all very happy.
The excitement was there. I mean, in January of 2021,
We already got it.
We started getting the
Yes.
vaccines, And it was one of the happiest days I had at the hospital that I was able
Yes.
to get a vaccine.
Absolutely, because at that time we did not know whether COVID would, like again, have a wave where it would be another pandemic and people would die. So having had that vaccine, I'm sure, did a lot of good for the population, and COVID eventually kind of became endemic.
Endemic means what?
Meaning it just stayed in the community with a few cases on and off. It's not rising to a point of epidemic where many people get it, or to a point where the whole world gets it like a pandemic. It's endemic in all areas.
So you expect during the winter time it should go higher.
Yes.
More people are close
Yes.
contact with each other.
Absolutely.
And
So
now we're in 2025. So there's really two questions about it. One is when patients come into the hospital with COVID-19 infections, most times they leave. Most time they don't have the serious
Correct.
death, the serious infections that we
Right.
see. And sometimes it's just someone comes in because they had heart issues and they got tested for COVID and they were positive.
Right.
So sometimes
Yes.
it just happens. So the two questions are, one, why is COVID now more benign than it was 4 or 5 years ago? And what are our recommendations now in 2025-26
Right.
about giving the
Yeah.
vaccine?
yes. So why has it become less virulent over a period of time? It appears that the virus strains have become less and less virulent, and most people have been vaccinated, so their ability to fight it immediately is still present, even though that immunity may be waning, but still they can fight it. But when they did not have the vaccine, they just could not fight it. So the virus itself getting weaker and people getting stronger.
Would you call that herd immunity?
To some extent, we cannot say with certainty that it's herd immunity, but to some extent that would have helped, because if the community, lots of people in the community had the vaccine, then the few people who didn't could benefit from all the people who got the vaccine.
So guys, as a team, you tell us, we're going to go down to the bottom line. If people have been listening to us for a few minutes, what should they do? Should we take the COVID vaccine or not? And who should take it?
Yeah, people who are immunocompromised, as Dr. Gauvain was saying, they would be better off taking it, because if they do get it, even if they have been vaccinated before, they can rely on that immunity from the previous vaccines. But still, if the strain is more virulent, if it mutates and becomes more virulent, you can come down with serious respiratory symptoms. So it would be beneficial if you are immunocompromised, if you are a diabetic, especially if you do not have your diabetes controlled, if you are on any form of like cancer treatment, if you have autoimmune diseases where you have immunosuppressive therapy that you are taking, it would benefit for you to take.
How about the
it.
age?
Elderly people are always, as we know, vulnerable to any infections. So that would also, they could go in that category too of people who take. The younger people, we can leave it to the individual, but if you are in a high risk situation where you're working with people who could be always at risk of getting COVID, or you have someone in your house, you're living with a family member who has a weakened immune system, then you would think about taking it.
So it's almost like the school system. And every year when my kids went to school in October, after a couple of weeks in school, if somebody was sick in school,
Yes,
the whole class got sick.
sick.
But not only did they get sick, but all the people in their homes got sick.
Got sick, yes.
So if you had a grandma there or grandpa there, someone older, so really all these things are not just for you not to get very ill,
Right.
but for everybody
Everybody
around you
around.
not also. So
Yeah.
that's an interesting point.
That actually is the science behind vaccines. So we must understand vaccines were created for a good purpose. And that still lasts because science is science. And we actually respect that. And vaccines have to be taken the way they were created and the purpose they were created for. And it is true.
And again, a generation before me, the idea about polio.
Yes.
People wound up paralyzed, which caused actually a neurological disorder, and they were paralyzed. They were on. It was the advent of respirators.
Mhm.
They used to call it the iron lung.
Lung,
Many
yes.
people died. We
Yes.
actually had a president with polio,
Right.
Yes.
Roosevelt, so he
Mhm.
couldn't walk. So the idea of overcoming polio was a major public health issue.
Yes.
And save people's lives, which you don't think about as much.
Absolutely.
But really, these vaccines absolutely have a reason to be there.
Yes.
The idea that young people, and these are people usually in their prime of life, would get polio and not be able to walk again
Absolutely.
is a devastating illness, obviously. With regard to COVID, we're not lucky, but because of this immunity and because the virus has mutated to be a little bit less
Yes.
virulent or bad, that's why we're not having the same issues that we had in 2000.
Absolutely.
So now I'm going to go rapid fire. So we're going to go over different vaccines and tell us a little bit about them. Let's talk about the flu shot. People don't even say vaccine, just the flu shot. Influenza vaccine, who gets it, who doesn't?
Yeah, so this is the unfortunate thing about the flu, because it mutates so much that every year the strain is going to be different. That's why you have to take it every year. Unlike, you say you take the hepatitis B vaccine and you get the boosters, and then you hope have the lifelong immunity, because hepatitis B hasn't changed its strains. But the flu does it every year, so that's why you got to keep taking it every year, and that might be a question that the public may ask or think, why every year? Because what you took last year may not protect you for this year.
Do people die of the flu?
Yes, especially the immunocompromised patients, they do die of the flu. And once they get the influenza pneumonia and then secondary bacterial pneumonia, I have had patients who have died.
So I'm sure you're telling all your people, and again, it used to be a hospital requirement that we couldn't
Yes.
be in the hospital without having a flu shot.
Or you have to wear the mask and work.
Right. Of course,
Yes.
there are always
Always,
workarounds,
yes.
of course.
Absolutely.
So I'll ask you now a little bit of a different question. A lot of people, when you study infectious disease, you sort of say to yourself, why isn't there a vaccine to this? Isn't a vaccine to that? So HIV, it's been around since the 1980s, 90s with the epidemic. I don't know if it made the term pandemic, but again, a very ubiquitous, terrible illness before we had treatments. The idea of people all around saying, well, there's a vaccine for this, I'm not sure I want to take it. HIV, people at risk, people working in the hospital, multiple risk factors. We would love to have an HIV vaccine. How many needle sticks I've had in my career, all of us, I'm sure.
Yes.
And just to take that angst out of the situation of getting an infection. When hepatitis B and C vaccines have come out,
C, not really, but the B.
B, and there's this treatment for hepatitis C.
That's
So
treatment.
we took diseases that were very devastating, almost fatal in different times. But with HIV, why can't there be a vaccine? Why isn't there one?
They are trying, but it is not scientifically, they are not able to do it. But what is there in the virus that is preventing them doing this is hard to understand. Will they ever get it? I don't want to lose heart on that, but time will tell. So this is not something that...
And it's a quite complex virus. It finds its way to evade our immune system. All these things. I think it's, the scientific community is working on it. We're having progress every day from what we're saying. And I think time will tell, as Dr. Jessie is saying, they've gone quite far with different, treatments to help, keep the virus afloat and help, people function quite well. The vaccine itself quite complex.
It is.
Yeah.
And if you think about the HIV, it uses the human machinery, and it integrates itself into the human DNA, and it remains there. So a vaccine against that has to be carefully thought out. Otherwise, the human part is also going to be involved in that. So that's what I am thinking as a possibility, but it's going to be a difficult one to get the HIV vaccine.
So it's not always our choice.
No.
Like we are now, sometimes there are no Lyme disease. People always
Lyme doesn't have one too. That's something that most people in Staten Island would love to have. They did have a vaccine, but it didn't give any protection, so there was no use with that vaccine.
Anything about things like malaria?
Yeah, malaria, thank God they were able to come up with that. So,
so there are some things that are coming out.
Yes.
So, but not yet around the world. I mean, has the malaria vaccine taken hold all over the world right now?
Wherever it's endemic and we're traveling, yes. Good thing that we don't have it here, although Staten Island did have in the early 1900s malaria, but we don't have it here anymore. So
thank goodness for construction. So we got rid of all the swamplands, many of the swamplands, so there's still enough mosquitoes out there. Absolutely. So let's talk about RSV now. And again, this becomes really, as I said, rapid fire. We've gone over things we can give vaccines for, things we can't. We'll talk about side effects of vaccines in a few seconds, but RSV has been another popular one.
Yes.
And we're in the colder part of the year, or getting to be the colder part of the year. Tell me about RSV.
It's another respiratory virus. It's called a respiratory syncytial virus. That's RSV. And again, people with immunocompromised status, diabetes, elderly, the same population are vulnerable to getting it, and then that leads them into respiratory distress. So that's the problem with all these respiratory viruses. So because of that and how much damage it can cause to the human body, the reason being that they produced the vaccine. So whoever who has these conditions should consider taking this vaccine.
Let's talk about some side effects. So again,
Yes.
RSV, important, as we talked about. Actually, one more before we go on to that. Tell me about shingles. Everybody wants to talk about the shingles vaccine. And tell you, in my population, especially people who are immunocompromised, or I'm going to make them immunocompromised. People with MS, people with
Yes.
various autoimmune diseases, where I'm going to put them on certain kinds of medicine that makes their immune system depleted in order for their own immune system, which is hyperactive, not to be as hyperactive. In those patients, we almost always will give the shingles vaccine before we start these agents.
Yes.
So we want to get the best response. So tell us about just with the general population, but maybe we'll just do part A, part B. What's the relationship between chickenpox,
Yes.
shingles,
Yes.
and the vaccines for
Yeah.
both?
So that's the first thing to understand. So these are viruses, right? The chickenpox virus. Once you get chickenpox, this virus remains latent in the body. And then eventually, when the immune system, for any reason, is put under stress, it can manifest as herpes zoster. Varicella zoster is chickenpox, herpes zoster is shingles. But it's ultimately the same virus, but manifesting differently. So people who have never been vaccinated with the varicella zoster vaccine, VZV,
That's the shingles vaccine.
varicella,
Varicella.
that's the
I'm sorry,
chickenpox.
the chickenpox vaccine.
Chickenpox.
Okay.
Yeah.
They could be at a higher risk because you do not have to have the blisters, the chickenpox itself, that you had the disease, because there could be what we call subclinical, where you don't know you got it, but you still could have got it, even a few viruses, and then that can remain dormant, and then eventually you can come down with herpes zoster, which is shingles. So some may ask, if you did get the chickenpox vaccine, should you really get the shingles vaccine? So it also depends when you got the chickenpox. If you got it as an adult, it's a high probability that in your childhood you might have had subclinical and then it's remaining dormant. Even if you got the chickenpox vaccine, it doesn't mean that you got 100% immunity. Some people do not even mount a good response to the vaccine. That's the individual. It's not that the vaccine failed, but it's each individual's ability to respond to that vaccine. And then, with that being said, you could still have come down with a subclinical infection. So all in all, even if you got the vaccine, that is the VZV, the chickenpox vaccine, you didn't get it, you did not get chickenpox ever, you got chickenpox, you still would benefit from the shingles vaccine.
And what age were the recommendation?
Above 50 is what, but
Right.
anyone can take it. Below 50, anyone who's immunocompromised can
yeah.
take it. And above 19 years, you can take it also.
And everybody should get the chickenpox vaccine, the children. now.
Children,
Sure.
yes.
It's
yes.
really dramatically
Yes.
changed things from the old chickenpox parties, where
Yes.
the parents used to want the kids to get chickenpox early at that
Yes.
point and
Yes.
see what they can come up with. So let's talk about side effects of
Yeah.
vaccines. I mean, we've talked about really how it's revolutionized the world, how we don't walk around in absolute fear of getting certain illnesses, but there are side effects to everything.
Yes.
And tell me a little bit about the side effects, and maybe you mentioned the mRNA viruses. There's been a lot of talk in the news about that maybe having more side effects than other kinds of vaccines. Tell us about your opinion about it and what
Yeah.
you recommend.
So, we start off with this, knowing that vaccines were made with a purpose and the pure motive of saving people's lives. Okay? Side effects happen with anything. If you take a medication, every medication you take has a side effect. In terms of vaccines, the most important side effect is a local swelling, pain, redness. That's almost always the common side effect. Coming to more difficult to manage side effects, it depends also on the vaccine. You can get like being under the weather, you feel feverish, you have a headache, like the symptoms, subtle symptoms of that infection against which you took the vaccine. You could manifest that. Especially if you're taking live attenuated, then definitely you might feel the symptoms of that particular infection. If it is inactivated, still you might come down with some subtle symptoms of that particular infection. But the serious side effects that people do dread, which doesn't happen most of the times, very rarely, are people can get seizures or neurological features.
Guillain-Barré,
I don't want to even mention that because people get scared. Just one out of a million would get it, and everybody will think, oh, I'm going to get Guillain-Barré. But that can happen with anything.
Sure.
So these are the common ones that we talk about. I'm talking about the extreme ones, which people shouldn't worry about. But the common ones are the local signs and symptoms that people get.
And again, back to COVID, so many of my patients have told me that after the COVID vaccine, they've had a lot of side effects, different issues.
Yes.
Have you seen that in your practice?
Side effects, meaning the simple ones that we just described, yes. But the ones that are very serious, I haven't seen in my practice, to be honest. I haven't seen, yes.
And I think maybe that's true and unrelated, where people get the COVID vaccine and then afterwards have something happen.
Yeah.
So overall, and again, we're coming to the end of our half hour, are you comfortable recommending family members, friends, yourself to get vaccinated most of the time?
Yes, I feel comfortable. Okay. And there is one myth, like some people have said, that I got the flu vaccine and soon after that I got severe flu. But the fact of the matter is it's not the vaccine. It is just that the person probably already had been exposed to flu, and it's just coincidental that it happens at the same time.
So maybe just on that point, how long does it take for the vaccine to work?
It takes about 2 weeks to 4 weeks, for the immune system to start acting against this. So it will take around that time. So that's why, especially in travel medicine, one has to take it well ahead of time. So you don't go there just the day before you go, you take a vaccine and you are staying there for 4 weeks. You definitely are not going to get protected from that. Yes.
I want to thank you guys for coming today. And I want to say to our wonderful audience, really listen to your healthcare provider. They know. They go to meetings, they go to all kinds of different things to parse out which of the vaccines come out, even the timing of vaccines, whether you separate the flu from the COVID vaccine. Everyone has their own opinion. But talk to your healthcare provider. They care about you. You will get the best answers there, and listen to them and not the news. Take care and have a wonderful night.